Hi, this is Lavanya, pursuing Pediatric Optometry in Indian Academy of Optometry. Now I am going to demonstrate about a vision therapy. What is about vision therapy? Vision therapy is a technique which has used to develop a visual skills and ability of a vision. It can enhance the vision and gives the interpretation for the perception of a vision. It can be an home-based and office-based therapy. Vision therapy can be used along with the spectacles and contact lenses. It can be mainly useful in convergence insufficiency patients, amblyopia or lazy eye patients. Vision therapy can be varying according to the patient's eye condition. And vision therapy of 5 types. First, pencil push-up therapy. Pencil push-up therapy is nothing but a convergence insufficiency therapy. In it, we have to use a pencil or like a pencil which hold the characteristics of numbers, letters, symbols, etc. which are used for an accommodation. There is letters which are used for an accommodation. We have to instruct a patient to hold the pencil or a pen at an arm's length and eye level and move close to the nose by maintaining the characteristics of letters to single but not blur or double. We have to instruct a patient to hold the pencil at an arm's length and move close to the nose by maintaining the characteristics singles. Once it can get a blur image, we have to try to maintain it as a single image. We can't get a single image, we have to move back away from the nose and repeat the procedure. This is about a pencil push-up therapy. Next, occlusion therapy. Occlusion therapy or patching therapy. It can mainly used in amblyopic patients. Occlusion therapy can be very effective in the age of until 8 years of an age. It can be very effective in amblyopic patients. There are the classification of an occlusion therapy. First, conventional or invasive occlusion therapy. Second, total or partial occlusion therapy. Third, full-time or part-time occlusion therapy. Conventional or invasive occlusion therapy. Conventional occlusion therapy is a direct occlusion therapy. It's a home-based therapy. Now in it we have to occlude at the normal eye and uses the amblyopic eye. In it we have to reduce the stimuli of a normal eye and increases the signals and cues from the amblyopic eye to the brain. Parents has to ensure that we have to occlude at the normal eye only and instruct the patient to do a near work as like cutting the papers, coloring, drawing, etc. Next, invasive occlusion therapy. Invasive occlusion therapy is nothing but an indirect occlusion therapy. In it, we have to occlude at the amblyopic eye. In cases such as a normal eye having an eccentric fixation, in it we have to control the eccentric fixation in a normal eye and then occlude at the normal eye then. Next, total occlusion therapy is nothing but an occlusion of an eye fully. In it, the light and form cells can be totally occluded. It can be avoided in patients such as the nystagmus patients because it can induce the intensity of the nystagmus. In that patients, we have to give a partial occlusion therapy. Partial occlusion therapy is nothing but a partially occlusion of an eye. In it, we have to use a penalization, which are drug penalization and optical penalization. Drug penalization in the sense we have to atrophize the normal eye and uses the amblyopic eye for the near work. In optical penalization, we have to use the plus lenses and uses the amblyopic eye. Next, third, full-time or part-time occlusion therapy. Full-time occlusion therapy is the first and foremost therapy. but it can be avoided in patients such as alternate strabismus and intermittent diplopia and all can induce us the occlusive amblyopia and strabismus. So for that patients we have to give a part-time occlusion therapy. Part-time occlusion therapy is nothing but part-time occlusion of one eye and part-time occlusion of other eye. That's all about an occlusion therapy, and there are the several classifications of an occluders are there, which are fully occluded of an spectacle occluders, contact lens occluders and tie-on occluders, headband occluders, etc. Next, move on to a prism or lens fixation. Prism or lens fixation can be used in patients such as an diplopia and asthenopia. It can be avoiding the symptoms like asthenopia and diplopia. For patients we have to give a prism or lens fixation. We have to ensure that what type of a patients and which type of a vision therapy can be given. Normally patients hesitate to wear spectacles with the prism, especially in the cases like after cataract surgery and strabismus patients normally not to hesitate to wear a spectacle with the prism. We have to ensure that in non-strabismic cases like vertical heterophoria, basic esophoria and divergence insufficiency in all, we have to give a prism. It can be very effective. In other cases like convergence insufficiency, convergence excess and divergence excess, basic exophoria and all, we have to give a lens or vision therapy. It can be very effective for those patients. And in prisms along with the vision therapy, for further following cases of non-strabismic patients, the amount of prisms can be reduced. Next, move on to a synoptophore. Synoptophore is a major amblyoscope and it can be done under the principle of a haploscopic principle. It is an office-based therapy and it can be used in both purposes as like diagnostic and therapeutic purpose. For diagnostic purpose, we have to evaluate the grades of BSP. Grades of BSP as like simultaneous perception, stereopsis and fusion. To therapeutic purpose, we have to use as for convergence insufficiency, divergence insufficiency and convergence excess, divergence excess, amblyopia, suppression and anomalous retinal correspondence and all. To diagnostic purpose, we have to use as the slides and slide carrier for the evaluation of an BSP. We have to evaluate the macular area, paramacular area and foveal area also. For therapeutic purpose, we have to use as the slides for convergence insufficiency and divergence insufficiency patients mainly. In it, there is two tubes which are right angle pen and are mounted on the base. There is two slide carrier which hold the slides for the analysis and therapeutic purpose. There is a chin rest and head rest which are used for the rest of a patient. And there is a reflecting mirror in the right angle bed which are used to reflecting the images from the slides to the eyepiece to eye. In it consists of a 6.5 diopter, that is plus 6.5 diopter. It's used for the image to see clearly. For convergence insufficiency and divergence insufficiency patients, we have to use the synoptophore for the therapeutic purpose. In it, the patient has to instructed to view the slides through an eyepiece and the examiner has to move the tubes by using knobs. That is, in convergence insufficiency patients, we have to converge the two tubes by using the knob, which means the inward turning of an tubes by using the knobs. In divergence insufficiency patients, we have to diverge the tubes, which means outward turning of the tubes for the divergence insufficiency patients. There is two tubes which are mounted right angle bend and are mounted on the base, and this is a chin rest and head rest which is used for the rest of a patient, and there is a slide carrier which hold the slides used for the analysis of a patient. And for divergence and convergence insufficiency patients, we have to diverge and converge the two tubes by using the knobs. There is a reading. It can be used to
converts the tubes and diverts the tubes for a convergence and divergence insufficiency patients.
Move on to a fifth vision therapy software is a computer vision therapy software. It's a recently and currently used vision therapy. In it there is a use for a saccadic and pursuits program. There is a home-based therapy which are perceptual visual tracking program PVT. In it there is a moving box, moving line, moving targets, hidden targets and saccadic tracking and all. The instructions are given to the patients by the program. And there are several classifications which are SANET Vision Integrator, Neurovision Rehabilitator, Vany Engineering and Track and Read etc. which are mainly useful for a current vision therapy program. It are downloading by the apps. It can be very useful as a home-based therapy also. That's all about the vision therapy. Thank you.